Hello everyone, I'm Dr. Shabahat. I welcome you all on this platform of Medical Global Health. As you all know, I'm a consultant cardiologist. I have been working in Ireland in various departments of medicine as well as a cardiologist in Ireland. So, uh, I will be discussing a very important topic today, which has a very effective and beneficial role in cardiac or heart patients. Also, it has been noted that it has many beneficial effects on other organs of your body. So, what is it? It is EECP. It is Enhanced External Counterpulsation Therapy. Other word for that is natural bypass. So before going in detail, I would like to ask you guys that if you can uh, subscribe my channel, click on bell icon, as well as share this important video with your family and friend, because purpose of making these kinds of video, if you have gone through other videos on this channel, is to educate my community with common words, and so that if they have any question regarding anything, especially if they have any question regarding their health, other issues, as well as if they have any question regarding the different therapies related to, especially related to heart, we will be discussing that in a layman language. So as I introduce myself, that I have been working in Ireland in various departments of medicine as well as a cardiologist over there. Nowadays, I'm working in Shabahat Hospital, Lahore, as a consultant cardiologist, as well as I'm running the European standardized cardiology department in one of the oldest and leading hospital of Lahore, which is Ramzan Ali Sayyid Hospital, which is located at heart of Lahore near Gangaram Hospital, and which is having address of 21 Temple Road, Lahore. So, what is EECP and what kind of patients will be getting benefits from this therapy? This is a very important question. And what kind of benefits we will be achieving from this therapy, and how we'll be performing that? So obviously, with the name EECP, Enhanced External Counterpulsation Therapy, with the meaning, it will show that we will generate a particular kind of pressure and give it to your heart in a pulsation therapy approach, uh, which may lead to opening of your small arteries, or it may lead to development of small arteries around, if someone is having blockages, or if there is no blockages, but still it will enhance their functional capacity, and it will lead to development of collaterals or small arteries around your big arteries, and it will ultimately improve the functional capacity. Or if someone is having or going through anginal symptoms, it will to be honest, like in around 80 to 90% cases, it will totally abolish those symptoms. So, how will we provide this EECP therapy? Obviously, we will be needing a EECP machine for that. So, it is a specialized machine which is always been run under supervision of a cardiologist, can never be run by any other non-professional doctor. And this therapy, I must say, and I should uh, tell you guys, this is FDA approved, American approved therapy, and it's been running around the whole world. Like, it's been there in Europe, China, Germany, UK, America, Gulf areas, in Pakistan. Just few dedicated and professional centers are providing it. But to be honest, uh, we are giving opportunity for these kinds of heart patients to have this therapy in our institute, which is Ramzan Ali Sayyid Hospital, and we are dedicated to provide this therapy according to European and American standards. So, how will it will be delivered? As I mentioned before, that we will give specialized pulsation therapy through your arteries of your legs to your heart, which is synchronized to particular part of your heart cycle, and it requires a dedication. Like it requires 35 sessions ideally, and which is early sessions, and it will be having gap of Saturday Sunday sometimes, but it can be continuous as well. But on dedication it requires 35 early sessions for completion of a particular course for this therapy. So what kind of patients can get benefits from this therapy? Those patients who are having stable angina or stable chest pain. Stable chest pain means that on a resting position or in a comfortable zone they don't have any kind of symptoms, and especially the young age patients who are developing symptoms, who may have small coronary artery disease which can never be stunted or bypassed, or they may lead to have anti-anginal therapy from a very early age. They can have this kind of therapy so that when collaterals will be developed, it will enhance their functional capacity or stamina for cardiac patients or these kinds of patients, so which may lead to not depending upon anti-anginal therapy in those stable patients as well as those young patients. Also, in any patient who is quite anxious about having strong family history and they want to increase their functional capacity of heart, or they want to increase development of collaterals around heart, so that whatever is happening in next few years it can be prevented without medications. So another category which is very important, who have coronary artery disease but unfortunately not suitable for bypass or stenting. It can be due to poor mobility, old age patients, as well as those patients which has very small coronaries or very thick coronaries, and there can't be a stent put in, as well as bypass can't be done. So in those patients this therapy will be very beneficial for them, and hopefully after a complete session there will be a complete resolution, or around 80 to 90% resolution of their symptoms. Also, if someone is advised for bypass, it is recommended as in class 2 indication that they can also have this therapy if they are not willing in terms of mentally, if they are not willing to have bypass or stenting at this time, they can have this therapy. But obviously in those kind of patients, first priority is bypass or stenting. And in those patients again who has gone through bypass procedure, but obviously they can't go through again and again bypass, so in those patients it will be recommended again they can have this therapy and they can have resolution of their symptoms. Also again, if someone had PCI or stenting done in past, again like they have developed symptoms, they can have this therapy. Also, if they have any blockage which can't be stunted and they are they don't want any further intervention, they can have this kind of therapy. So again, this is very beneficial because it will regenerate, or I must say it will open up small arteries around your major arteries, and it will also help out them to provide blood supply to myocardium of your heart. And it can also create a natural bypass around blockages of those arteries. And it has been proven that most of the patient who has gone through this therapy, they got benefit. So also in many other patients, like in cardiac rehab, like if they had stenting, they had bypass, but obviously if they are not mobile, or their diabetes is not controlled, their blood pressure is not controlled, and they could not have uh, all of the medications, again it will lead to blockages of all the stuntable, or whatever intervention was done. It will lead to again blockages of them. So in those patients it will be beneficial for them. And again, if someone is having chest pain or angina symptoms and they are on multiple anti-anginal therapy, they can also have this therapy. And it has been seen that the number of drugs is reduced, because whenever there is collateral development or small vessel development, obviously the functional capacity of heart, the stamina of heart is increased. Another important patient for this therapy is heart failure patients. It has been seen that, as we all know, that whenever someone is having heart failure, they are unable to walk properly, they will be having shortness of breath on small walk. So this therapy, they can have it on lying flat, they don't need to walk. It will uh, work for them. And it has been seen that in heart failure patients, it has created beneficial effects, and their heart is becoming, or their heart has been noticed that getting strengthened from this therapy. And many poorly LV function patient has gone to moderate to good LV function, but it has been noted that it has improved their heart functions in heart failure patients. So this is a major or a big categories of patient, especially heart patients, which can get benefit from this therapy. It has been noted that it gets benefit, or this therapy can give benefit to many other patients which have many other diseases like dementia, stroke, and many other patients. And obviously many researchers are going through to prove this beneficial effect of this therapy in those patients, because this therapy will increase blood supply not only to heart but to other organs of your body. So in Ramzan Ali Sayyid Hospital, we screen every patient, and after screening, we advise them if someone is suitable for this therapy or not, and then we will advise them to this therapy, and we will provide them complete pre, during, and post therapy overview, as well as their monitoring, surveillance of everything is going on. So we have designed this program in Ramzan Ali Sayyid Hospital and cardiology department over there on a completely standardized European and American standards. So another important thing is that how many years it can have benefits. So it has been seen that if someone has adopted a good lifestyle or diet modification after this therapy, it has given same beneficial effect, or I must say near to same beneficial effect of stenting or bypass. Uh, uh, but again, as we all know, that even after stenting or bypass, if someone is not adopting lifestyle or diet modification as well as compliance with medications, uh, they again lead to develop blockages of their arteries. So with this therapy, we need adherence and compliance of other things as well. The most important and benefit of this is there is no cut, no bleeding, nothing is happening over there, and patient is lying flat in a comfortable environment, and they are having early session. Saturday, Sunday will be off for them, and 35 sessions, and many of the patients are getting a lot of benefit. And I must say, you, or if any of your family or friend is having issues, as I advise or tell you before, they should adopt this therapy and they should get this therapy so that they can get same benefits as many other patients are getting in Europe and America and many other. And it is a non-invasive therapy, to be honest, and you should adopt it. I hope so. This video will be beneficial for you guys and you have understood about this therapy. If you have any question about that, you can Google Ramzan Ali Sayyid Hospital website. You can Google us. You can Google my name, Dr. Shabahat Ali. You can find my contact number. If you have any question regarding this, you should visit our hospital as well as so that we can guide you and we can provide you about complete overview how this therapy is happening. Thank you so much. Take care. Bye bye.